Good evening, everyone, and thank you for joining us for the Ross University School of Medicine Facebook Live event this evening. Here in the Eastern Time Zone, it's 7 p.m. It's gotten dark as we approach the Thanksgiving holiday. We're coming up on the holiday season in general. We really appreciate you joining us this evening. We hold these events on a regular basis for our prospective students. The idea being that if you're unable to make it out to one of our in-person information sessions, that we can bring the alumni experience straight to you in the form of a short conversation with a couple of our notable alumni. So as we begin, first of all, my name's Sean Powers. I'm Director of Admissions for Ross University School of Medicine. Happy to be here with you. We're coming to you live from our offices and our clinical location in Miramar, Florida, where our Internal Medicine Foundations program takes place. A number of our faculty and staff have offices, including many in the administration have offices here in Miramar. And as many of you, again, are aware, we've just announced last week, Dean Owen announced last week that we will be resuming our classes January 2018. Our upcoming term will be in the United States in Knoxville, Tennessee, in facilities owned by Lincoln Memorial University. And we're very fortunate that call was made and the offer was made for us to move to Knoxville, Tennessee for the upcoming semester, which will be January till April. And then we anticipate returning to Dominica for the spring semester, which commences in May 2018, and we'll be back in Dominica next summer, essentially. Many of you watching out there have begun applications for admission. We have a number of folks who are sort of in that process right now, and certainly, not surprisingly, have been asking on a regular basis, well, if I'm applying for the January term, where will I be attending classes? So now we know. Now we're able to tell you that you will be in Knoxville, Tennessee if you are accepted to the January term. By the way, even though it is mid-November this evening, as this broadcast comes to you, there is still time to make your application for the January term, or for many of you out there, to complete the application that you've already begun. We have a staff based here in Miramar who is ready to work with you, walk you through that process, take you by the hand, and hopefully have your interview take place very soon if you are ready to go. Even if you're applying for the May 2018 term or next September, certainly as well, we are working with students for the next 3 terms starting in 2018. So plenty of time still to complete that application and enroll at Ross in 2018. But joining me this evening, I'm very happy to have 2 of our alumni who are volunteering their time this evening. We really appreciate it, and bringing their experience to you, the prospective student. To my left is Dr. Melissa Wu, 2016 graduate of Ross University, who is currently in her internal medicine residency at Cleveland Clinic right here in Florida. Thank you for joining us, Dr. Wu.
Thank you for having me.
And also Dr. Emerson Frank. Dr. Frank, a 2017 graduate, newly minted 2017 graduate of Ross University, who is in his first year of residency nearby here at Aventura Hospital in emergency medicine. So thank you very much to both of you for joining us this evening. I know the prospective students who are watching throughout the world benefit greatly from your experiences and your perspective. Since I gave such a brief introduction of both of you, what I'd like to do is I'll ask Dr. Wu first, as the senior member of our 2-person panel, to maybe give a little bit more of an introduction, a little bit more about your background, why you chose to attend Ross, maybe how it helped you, and a little bit about what you're doing today in your residency here at Cleveland Clinic.
Sure. Thank you very much. So I had quite a non-traditional background. I'm originally from New Jersey. I was a music major in college at Vanderbilt University, but I always knew I wanted to go into medicine. I was very fortunate in that the Vanderbilt University undergraduate campus has a health professions advising office where they're very familiar with Ross, very supportive in my decision to apply to a Caribbean school in general, and they had heard all good things about Ross, so I applied during my senior year of college in 2012. My admissions decision was MERP, so of course it was a little scary in that I was taking a chance. It's a conditional acceptance in that you have to pass successfully in order to continue on to the basic sciences in Dominica. But I successfully passed in the fall of 2012 and started on the island of Dominica for my basic sciences in 16 months. from January 2013 to April 2014. I then came to South Florida for the first clinical semester, which every student participates in South Florida, and decided to stay in South Florida for the South Florida track. Really, really, really enjoyed my time at Cleveland Clinic, Florida, and was lucky enough to have been offered a position for residency there.
Excellent.
So.
Now, you mentioned MERP, and just to clarify for those who may not be aware, that's the Medical Education Readiness Program, which takes place right here, actually in this building, here in Miramar, Florida. And the idea behind the Medical Education Readiness Program is to give students with great potential for success in medical school the opportunity to essentially strengthen some of their foundational skills, right? Would you say? Now, and some of the coursework and some of the themes and topics mirror what you will eventually see in the first couple of semesters of medical school, but the focus is more on attacking the material, correct? So, and by the way, the next MERP class commences on December 5th, right here in this building. So for those of you who are applying for January, if MERP is the decision of our admissions committee, which is our faculty who make all the admissions decisions, the opportunity to start in MERP, it's a great opportunity, as Dr. Wu mentioned, and completing MERP, the December MERP, which is the next class to commence, as I mentioned, will allow you to then sit in the semester 1 class coming up in May. So, with MERP, in your case, how did it help you prepare to succeed in semester 1?
Yeah, so thinking back on it, I just really didn't know how to study in my undergraduate time. So it really set me up for success in many ways. First being like figuring out what worked for me in terms of studying. They help not only learning materials in the basic sciences, and helping you have a strong foundation in medical knowledge, but also helping with study skills. They hold seminars on with doing board review questions together. So it sets you up for success in both having a good foundation in the basic sciences as well as figuring out how to study, because I needed a lot of help, and Ross gave that to me.
The nice thing about it too is, and if you're listening out there and you haven't heard of MERP, it may sound something like a post-baccalaureate program to you, because in many cases when you're denied from admission to a medical school, the medical school will come back to you and say, well, if you go to a post-baccalaureate program and then reapply here, we'll take another look at you. However, the medical schools in the United States, there's no guarantee of acceptance when you do that. At least with MERP, there's one of two guarantees. And by the way, it's the Medical Education Readiness Program. You can find that right online, and you can link to it right from our website actually as well. The key thing with MERP is there's one of two guarantees you will come away with. As you mentioned, all you have to do is pass the program, and you're guaranteed a seat in semester 1 the next semester, which is what happened for you and happens for many students. But on the flip side, if you, for some reason, are unsuccessful, or you find that you just weren't able to make it work and you weren't able to pass the program, there is a 100% tuition refund that is given to students who do not make it successfully through the program. So, you're taking a chance, obviously, and we don't see it that way, because you're betting on yourself. You are coming in and you have the potential, which is why our admissions committee has given you the opportunity to come to MERP. At the end of it, you either have a seat in semester 1 or you have your 100% of your tuition money back. So it's a fantastic way to go about it. If MERP is the decision for you, it's a very positive one and works out well for our students. And many students who have gone through MERP come back and have very similar stories about how it helped prepare students to then ultimately succeed in the basic sciences. So, and that's just a few weeks away. December 5th is when our next MERP start date is. It doesn't run concurrently with the exact semester, but starts about a month before each semester. So then, the students who begin in the December MERP class next month will then finish in time to prepare to start in semester 1 in our May term. So that's a little bit on the Medical Education Review Program. So let me turn now to Dr. Frank, Dr. Emerson Frank, again, 2017 graduate who is now at Aventura Hospital in emergency medicine. So same as I asked Dr. Wu, maybe a little bit more about your background, a little bit more about why you came to Ross and how it's helped you in your current position.
Okay. So I actually found out about Ross when I was an undergraduate at Quinnipiac University back in Connecticut, where I grew up. A Ross representative came and had a huge presentation, showed pictures of the island, and actually kind of fell in love with it at that point. I applied to U.S. schools and Ross at the time of my senior year. Did not do well on my MCATs. Took some time off and worked full-time EMS on the ambulance for a couple years. And then when I studied for the MCATs, again, didn't do very well. I said I'm going to go to Ross because they were more about the non-traditional people that could make it without having that one score. So then I went to Ross September of 2013, graduated just now in March, and I loved all of it. It prepared me really well for what I'm doing now. It's made me very competitive in my residency program, and it made me really competitive as an applicant for residency as well.
Now, I mean, emergency medicine, obviously a competitive track to get into. You've clearly always been an emergency guy, an EMS guy first. So when you say that it clearly made you competitive, in what way? How did you feel that the program made you competitive?
So before I went to Ross, I started master's work, but I actually stopped it to go to Ross. Being on the island kept me from a lot of the distractions I would have had back home. So I was able to study and dedicate a lot of my time to studying. And as you progressed in basic sciences, the exams got harder and more standardized and more to what you would see. And my study ethic either stayed the same or got better, which made my scores better. And then clinicals, we were doing clinical stuff semester one. We were doing clinical skills and some standardized interview stuff, which progressed thoroughly through, and then everything just kind of made all my scores better from USMLEs. And I had a lot of opportunities on the island to get involved with the community and everything as well.
It's interesting that you say that too, and when you tie that back to how you referenced the MCAT earlier, you talked about not being as pleased with your MCAT score, and so many times students are maybe disappointed with their MCAT score, and maybe it's only because they know that it for many schools it's the determining factor in whether or not they're going to have an opportunity to attend med school, which then in turn becomes whether or not they have an opportunity to pursue that dream. So it is true that we're a little more forgiving on the MCAT, but clearly in your case, you don't feel that it impacted you because you were still able to move on. And in the other critically important exams, the USMLE Step 1, Step 2, you feel that you were able to be just as prepared for those exams.
Absolutely.
And so it sounds like you feel like you were much stronger with those exams than you may have been on the MCAT.
Absolutely. I also knew that when I went to Ross that I had to work hard to get to where I wanted to be. And I wasn't going to let the MCAT be an exam that defined how I was going to prepare for everything else. And the USMLEs are, I wouldn't say easier, but they're clinically relevant to everything that you're learning, so it makes it a lot more fun to study for it and actually motivates you a lot more. I wouldn't let the MCAT, I was like, that's not going to be what holds me back.
That's interesting that you just mentioned the term clinically relevant. I'm going to ask both of you about this. We really pride ourselves as a university on introducing clinically relevant material right away from semester one. And we do so in a number of ways through the basic sciences with introducing patient simulation right away and clinical cases right away. And I say right away, I mean from the very first week of school. And it's something that you're continually focusing on throughout the basic sciences. So then when you move on to the IMF, the Internal Medicine Foundation semester for 6 weeks in between the basic and clinical sciences, you're already pretty well prepared to do that. And then from there, that's putting the finishing touches on your clinical skills. So then you can confidently walk into a hospital for the clinical sciences, your clinical rotations in the second half of your curriculum. So can you reflect on, and I'll just sort of throw this out there and make it as general as I can. Can you reflect on being able and sort of what you did really in the basic sciences, because traditionally the basic sciences is the bookwork, right? But that's not the case anymore in medical education. Getting access to clinically relevant information from the beginning is certainly key. So what did that mean for you, and how did it work for you when you were thrown into those early clinical cases? What do you remember about those, and how did you learn from them?
I remember for me, they were kind of scary because we were just dropped off in like a simulation lab, and they do high yield emergent cases with us, and it's scary. But the beauty of it is that by exposing us to so many standardized and simulated cases. It's a safe environment that's like, okay, that's great for learning and just really learning from mistakes, because we're going to make a lot of them. And just it's also great because it was getting us right from the start thinking clinically and applying what we're learning every day in the classroom from the lectures to a high yield emergency room acute care type of case. So it got our feet wet really early, which was great because, to be completely honest, right when you start residency, you will be, and even just those clinical rotations in third and fourth year, you will be dropped into those situations, and you'll need to learn how to adapt and think, how can I do better next time? So in that way, Ross does a great job of exposing us really early on, but yet in a safe environment too. And they also give us time to reflect on it and talk about it after, which is a really important part as well, to be able to process it.
Let's face it, as an emergency medicine physician, and someone preparing for that, probably your first emergency case shouldn't be in your third year.
Right. Yeah, I agree with what Melissa said. Is the cases that we did, and we did high fidelity simulation, we did Harvey, heart sounds, so that you can get used to hearing heart sounds, and even just standardized patients from the first month of Ross. And all of those cases ended up linking back most of the time to what we were learning in the books as well. But the simulations that started on the island even, and then in IMF, they definitely prepared me for third and fourth year. And even with some of my experience in the background, I felt more prepared going into my clinical rotations. And I had met people on my away rotations at other hospitals that were not as prepared. Even, this was fourth year and they still weren't as prepared as I was. And I would even argue that how much clinical work we do at Ross for emergency or non-emergency situations with the standardized patients made me more competitive, I guess, I don't know what the right word is, but in residency, I feel much more comfortable with a lot of patients than some of my colleagues do.
Interesting. And they've probably gone to medical schools around the U.S., maybe other parts of the Caribbean, other parts of the world. Okay. That's excellent. I'm going to come back to talking about clinicals in just a second. Those of you who are just joining us, just to make mention, joining us here this evening for Ross University School of Medicine's Facebook Live event, which we do on a regular basis with a few of our alumni, to talk about their experiences and bring that experience to you if you're not able to make it out to any of our in-person events. Taking applications, continually taking applications. We don't have a deadline because we bring in a new class, a new entry. There's 3 entry terms per year, and so it's a completely rolling basis. We are still accepting applications for our January, May, and September entry dates for 2018. And as many of you out there have already heard, we are currently away from our home in Dominica for the basic sciences, and we are relocating to Knoxville, Tennessee for the January 2018 term. So as an incoming student for January, you would have 1 semester in Knoxville, Tennessee, and then 3 in the basic sciences campus in Dominica when we return there in May 2018. Applications right online on our website, rossu.edu. You can fill out our application, or alternately, if you've applied via the AMCAS system here in the United States, and you have the PDF of your AMCAS application, you're able to send that in to us at admissions@rossu.edu, and we will use that as the basis for your Ross University application to make the process a little bit simpler. Even if you don't have the MCAT yet, if you have a test date coming up in January, let's say, and you're interested in applying for the May 2018 term, we can gather all of your other materials, all of your transcripts to go along with your application, even conduct the interview. Get all of that out of the way, then once the MCAT score comes in, then we will submit your file to the admissions committee for a final decision. So that's just a little bit about the application process that we've been talking about this evening. But going back to the clinical rotations, Dr. Wu, you mentioned tracks. You mentioned that you were here in the South Florida track. And specifically, what I want to talk a little bit about is we have 10 different tracks, 10 different locations, geographic locations, where as a student you spend your time in the 3rd and 4th year to complete your clinical rotations. You mentioned being down here in South Florida. Now, how did you choose that? And interesting for you, Dr. Frank, where did you spend your
Jamaica, Queens.
So you were in Queens at Jamaica Hospital Medical Center. We do have a Connecticut track at Danbury and Norwalk. So we have 10 different geographic locations around the country. So depending on where you are from, potentially you could head back home and live near home to complete your clinical training. So in your case, Melissa, you mentioned you were from New Jersey, but you came down here for the South Florida track, and it's turned into a job for you, as obviously they liked you, and it was a good audition for you while you were here at Cleveland Clinic, and you've stayed there. So what made you initially choose South Florida?
At the time, so every semester of IMF, the 6-week rotation down here in South Florida that every student does before their third year. There are certain tracks that are made available at certain times of the year, and South Florida was one of them. Unfortunately, there wasn't one in New Jersey at the time, but I also wasn't looking to go home to New Jersey at all. I've been pretty open to like new experiences, new locations. So knowing that there was Cleveland Clinic as a possible location that I could potentially rotate at, that was a great location. So when I was matched and paired with it, I was very happy with the decision.
And certainly no looking back. You've continued on there into your residency, so that's great. So obviously they're very happy with you. Now, on the flip side, then Jamaica, Queens. So you're a Northeast guy, so then you go back and you're in Queens, New York, and how did that work out for you? How was Jamaica for you and being in New York?
I loved it. So similar to the story when IMF came around and we applied, there was no Connecticut track at the time available for me, and I wanted to be closer to family. And then Jamaica was also in New York City, and it was always my dream growing up to live in New York City, so I got to do that as well.
That's great.
And my experience was somewhat different than other people, not necessarily at Jamaica, but at some of our other sites, because of how diverse New York City is, and our hospital is right directly the first hospital you get from JFK.
That's right.
So everybody from the airport comes to us, and you don't always know the language. It was a great experience. They let us do a lot of stuff. I learned so much more than I would say that some of my colleagues did at other places, both American grads and Ross and St. George's. I got to experience that, and I loved every minute of it. And I stayed there for most of my fourth year, except for emergency medicine. We have to do our away electives. So 2 of those I spent in Chicago and Michigan. But other than that, I stayed in New York, and I loved every minute of it.
And in the fourth year, obviously, you're working on defining your specialty and preparing to apply for residency. So can you talk a little bit about some of the process through the university preparing to go on residency interviews? We have the Office of Student and Professional Development that assists both with career advice as well as writing. There's a whole team that prepares the medical student, professional performance evaluation of your medical student experience at the university. So can you talk a little bit about how the university prepared you to go on to those very difficult residency interviews that obviously, ultimately were very successful for both of you?
Yeah, so again, with the Office of Student Professional Development, along with many other aspects of Ross, they are always there to provide you with some sort of resource and help. And I think one of the great things that they offered was mock interviews. So being in South Florida, I was able to come in person. If not, I know they conducted interviews via Skype with the advisors, which was a great way to just get practice. And we got real-time feedback afterwards, because you never want that first interview to be the first time you're getting some of those tough questions. And I know when I was starting my rotations, I wasn't the type of person who knew exactly what I wanted to do. Discovering that I wanted to go into internal medicine came kind of later, and my advisor really helped me through that and helped guide me towards that decision. And then there's also a lot of webinars that Ross hosts to help us prepare for what exactly does a residency application, what are things that they look for, and formatting, even things like that, and how should a CV look. So all things that they might seem like details that might go by easily, but when you're applying for residency, every detail actually really does count. And Ross knows that, and they helped us prepare each step of the way as we were applying.
I would agree. Even in IMF, you guys helped us with connecting with other alumni, and even some of the junior faculty that are here to help us during IMF. They wanted to go into different specialties, and so they were a connection for us as well. But even going further along in fourth year, the mock interview was really helpful for me. Being able to be told what I was saying that I didn't even know that I was saying, or filler words. And our personal statements got looked over by the OSPD people and our CVs, and I think those were really helpful for me to see what I needed to change and make better for my application. And they were always helpful for me because we have, internal medicine, our OB, we have, chairs of the departments. For emergency medicine, we don't, but everybody was helpful with getting me associated with alumni or the right person to talk to. So I never felt like I was missing anything.
Excellent. And again, for those of you joining us, this is Ross University School of Medicine for our regularly scheduled chats with our alumni to help prospective students prepare their application for admission, which we accept at rossu.edu. Right on the admissions webpage, we also accept the AMCAS PDFs to help you begin the application. We have 3 entry terms per year. Our next class starts this January in semester 1. We also have a May 18 start date and a September 2018 start date as well. Now, Dr. Wu, you mentioned that before when you were talking about the MERP program that you started in the August MERP, which prepared you then, once you passed, program to start in January a few years ago. And Dr. Frank, you were a September start, and obviously so 2 different perspectives. Yet, both of you, when we were talking prior to the event this evening, both of you saw the value in beginning in January or May, and what some might see as a sort of off cycle, being that September is the traditional start date. Yet, for many reasons, for some students, starting in September is not possible. So, in your mind, why would starting in January be a good time to start medical school?
Yeah, again, like you said, it might seem off cycle, but thinking about it, I actually had more time to kind of take time off to study and take my time with taking my STEP exam, because that's an exam that you don't want to rush. You want to take your time, and then also planning for clinical rotations. I again didn't have to rush through and do back to back. I could take my time. I decided to take a little bit of time off to study for step 2, so it gave me some flexibility in how I was able to arrange my schedule. And then even if you graduate off cycle, which I did in November 2016, there's a lot of opportunities with Ross. You can work as a junior faculty, which I did for a little bit of time. You can also take your step 3 in that time off. It gives you also flexible time to travel for interviews, because it's tough to schedule that when you're actively in clinical rotation. So also, not to mention in a January or May class, the class sizes are smaller, so you have the potential to get a lot of one-on-one attention and ability to work with the professors in each class, which I personally like. I like a smaller class size. So yeah, there were a lot of really positive things about it.
And if the decision is MERP, being that the next class starts on December 5th for the Medical Education Readiness Program and completes in the mid-spring, set students up to begin in semester 1 come next May. In that case, comparing it to someone who starts in September, it basically gives you a 1 semester head start, because those would be folks that you would be going through the process and going through the residency matching process with, correct?
Correct.
So that would be something to consider. So those are all reasons why you might want to be considering Ross University for some of the 2018 terms, depending on where you are in your personal journey toward your MD. I want to thank both of you for being with us this evening. Dr. Wu, Dr. Frank, thank you for volunteering your time. I want to thank everybody who's been watching across Facebook. We appreciate you checking in, learning a little bit about Ross University School of Medicine. Again, accepting applications for January, May, and September 2018 at rossu.edu. We have a great team of admissions staff here in Miramar, Florida, just waiting to hear from you and work with you, move you through the process. And once you get through to that interview, which would be with one of our staff members around North America, after the interview, usually only about a week till you receive your admissions decision back from the faculty, because they meet once a week and we truly operate on a rolling basis here. So if you're ready to go to medical school, this may be the place for you. So that's where we stand today at Ross University. Again, I'm Sean Powers, Director of Admissions. I want to thank you for joining us this evening. It's a pleasure to have you along. We look forward to working with you. Take care. Have a great evening.